All right, welcome, Dr. Tishler.
Oh, thanks for having me on. This is
Yeah,
great.
it's a pleasure. It's a topic that I've been wanting to have for a long time. And as I've told you just before our interview, I'm what I would consider kind of a novice or ignorant to the topic at large, meaning the ramifications of the history of cannabis and the what's happening in our politics, what's happening in the industry, what's happening in the medical world of it. So I really just want to pick your brain and
Awesome.
get your knowledge.
Good.
Yeah,
Cool.
you're at the top of your league. First of all, congratulations. You were just named a very important kind of
The Americans for Safe Access, which is a great organizing group focused on patient care. I had the honor of being named their 2021 Clinician of the Year. So that's a great honor for me. It's been it's lovely to be acknowledged once in a while.
yeah, that's super. And you're really at the forefront. You're a pioneer in this field. Are you still working at Harvard currently?
I am faculty at Harvard and the Brigham Women's Hospital, but most of my effort is focused on my private practice, which is called InhaleMD, and also on the Association of Cannabinoid Specialists, which is a not-for-profit that I founded some time ago, really for the purposes of educating everybody, whether that's other doctors or other clinicians, as well as lawmakers, so that we can have policy set up that really takes care of patients. And that's really one of the issues that we're facing at the moment, is that, even in the medical cannabis world, the policies across the various states are sort of very loose and set up sort of for the benefit of the industry. That has its pluses and minuses, but one of the minuses is that it's not very effective for we clinicians to try to treat our patients. And there are aspects of the sort of looseness that makes it very hard to make sure that patients are getting what they need and that they're not getting excessive amounts and all of that sort of thing. And that actually sort of segues into your discussion about wanting to talk about PTSD and anxiety, because those are illnesses that for which cannabis can be helpful, but also can be harmful if it isn't done carefully and with precision.
Ah, okay. So this brings up, it's a huge topic. We could talk all day about it because I do have a million questions, but the policies that are in place state to state, first of all, it's confusing as all get out for someone like myself. I have no idea. I'm in New Jersey. I still don't know what's legal, what's not legal. I'm not a cannabis user only because in the past when I tried it, now this was 20 years ago, I had a very adverse reaction. So I've kind of been scared of it, to tell you the truth, And I don't know if cannabis is, there's so many different qualities of it, growers of it. The industry has been kind of all over the place, kind of a bootleg industry. And then there's been obviously this more medical grade industry that's happened over the last few years. A person that is seeking help in whatever state they're in, obviously there's the laws, but a person that is seeking help with the benefits of cannabis, where do they even go to start to understand what might be helpful for them?
That's a great question. Unfortunately, it's a little bit of a complicated one. Right now, we are working to educate cannabis specialists or cannabinoid specialists across not just the country, but around the world. And there aren't as many as we need. So right now, we have however many physicians that are out there, and most of them don't really know a whole lot about cannabis medicine. That's unfortunately a statement that gets thrown around a lot to say, well, don't listen to the doctors. They don't know what they're talking about. And I would just remind the listener that when it comes to your healthcare, any physician, whether they know anything about cannabis or not, is still going to know more about you as an organism than the guy down the block at the dispensary. So it is true that physicians don't know much about cannabis as medicine, but that's what we need to work on. And that at least as a physician, they have a good framework for understanding this stuff as they're educated.
So where you're standing and your perspective and viewpoint and your ongoing work in this industry, is that education for doctors and physicians, not just general practitioners, but a variety of different physicians, is that something that is in place now? Are there systems and protocols and training programs that are in place now?
Well, we're getting there. So right now, the sort of traditional approaches to training physicians don't exist in this field, but we're working on it. For example, right now, I'm developing a fellowship, which is sort of how people move from their general training, which is the residency in which they might do internal medicine. Then if they wanted to become a cardiologist, they would do a fellowship in cardiology, and we're developing a fellowship in cannabinoid medicine. For doctors who are out there sort of already in their career, there are kind of two groups that we think about. There are the doctors who, like myself, want to practice this kind of medicine, and they need a very deep, specific set of knowledge. And so we have, through this Association of Cannabinoid Specialists, developed training for those people, and that exists. So we're working in that regard to make that knowledge available. Then there's the other group, much larger group, who are the physicians who are not going to do this, but they need to know enough about it to understand when it might be helpful and what are the risks associated, so that they can respond to their patients, right? So Mrs. Jones comes in to see her doctor and says, I have, my bad back is acting up again, right? And that doctor can go, well, we've tried all of these other meds. It doesn't seem to have helped you, Mrs. Jones. How about we try some medical cannabis? So they understand, number one, that this is the time when they should refer, and then be able to say, I'm not a specialist in this, but Dr. Tishler is, so why don't you go over and see him, and I'll send him a note to make sure that he knows you're coming. And that's exactly what, that's the way medicine works. If it's, coming in and you're having chest pain, eventually you get referred to the cardiologist. So it's not really any different that way, but we're sort of at the starting point of getting everybody up to speed on that.
I see. So I think what I hear you saying is, if you're interested in cannabis use for medicinal purposes, it's still better to go towards a physician or someone who knows your medical history that can refer you out, rather than trying to self-diagnose and go down to the local dispensary or the taco truck and get a joint or whatever you call it these days. I'm going to age myself
I
here.
couldn't put it any better, honestly. I think, the industry very much, and I've heard this from some of the top CEOs, they would like everyone to sort of DIY their healthcare and just come on down and we'll sell you some weed and it'll be great. And what we know is that that's really not a good plan. It's great for their bottom line, but that doesn't move me very much. But what we see is that, first of all, DIY healthcare, regardless of whether we're talking about cannabis or any other field, is just not a very good way to do things. On top of that, there is a lot of misinformation out there, a mixture of sort of stoner lore, which is then often reinforced through this new industry because it lends itself to selling more product, right? So there's all this discussion about different types of cannabis that really has no actual scientific basis. But it makes it a great thing to sell because, oh, well, this kind didn't work, so try this kind. Oh, try the other kind. And it sort of sets up this quest for the Holy Grail. Like, I have to find the perfect kind of cannabis for me because I am a unique individual. Well, yes, you are a unique individual, but the medicines all work the same way. And, sure, they need to be adjusted, but the idea that you just need to keep finding and trying, that's really a sales pitch.
Okay.
Understanding sort of how to do dosing, when it should be used, what are the pitfalls that we can avoid if we know that they could be coming. Those are the things that a clinician really should be doing for people. To make matters worse, we know that there are physicians who are employed in what we call card mills, which are groups that say, come down to see the doctor, maybe it's telemedicine, 15 minutes, you get your card and you go to the dispensary.
Mm-hmm.
And that's not practicing medicine, right? There's no discussion of risks and benefits. There's no follow-up. There's no instruction on dosing and timing and all of those things that are really important in making sure that people not only get the best benefit, but avoid the risks. And there are risks. I mean, and in Massachusetts, which is a little ahead of New Jersey in terms of the recreational legalization, I'm now seeing people coming to me who started with this DIY approach through the recreational stuff, and they're already overusing and perhaps misusing this stuff. And then I'm in the position of saying, look, you know what, we're actually going to get you better benefit and decrease your risks if we kind of reel it back in here and be a little bit more precise and specific about this. But that's such a tough sell, right? I mean, that's hard to say to people. It's much easier if they're starting from square one and you can say, all right, well, like, these are the risks, these are the benefits, and this is how you do it. There's no kind of like remedial education. It's all going forward from the start. Much, much easier. So the whole recreational DIY thing is actually making things tougher.
Interesting. Well, I can imagine, and again, out of my ignorance, I have to ask this as far as the regulation of, I know when it was illegal or for recreational use, you know, people are growing it in their backyards and they're growing it in their containers in their bathroom upstairs. And, you know, so out in the world, what's being sold, I'm assuming the recreational cannabis is not regulated in any regard. Is that correct?
No, it varies from state to state, but almost all of the states are regulating the safety of the recreational stuff as well as the medical. You know, interestingly, it's very different from state to state. So in Colorado, for example, ironically, the regulations around the recreational cannabis are actually tighter than those around the medical. And that has to do with the history, which is that the medical came first. And so they didn't think they could push through the tight regulations. So they went looser ones. And by the time we got around to the recreational stuff, people were more willing to entertain the notion of tighter regulation. And they never really went back and filled it in on the medical side. In Massachusetts, it's all regulated the same. So, you know, in terms of safety and quality, whatever you get in Massachusetts, whether it's medical or recreational, it's tested to the same standard. And I frankly think that that's the way it should be. There really needs to be a national standard.
Right.
And it needs to be a tough one because we do not want people getting sick from this stuff that's supposed to be medicine.
Well, so I'm going off of, you know, like what you see in the movies and you hear friends talk about, like, you know, that was some good weed. And like, this weed is different than that weed. And this, you know, it's not, they don't make it like they used to anymore, you know? So I'm going off of all that information thinking, well, how do you know what you're ever getting? You know, I use herbs a lot. And I know when I buy extracted herbs, you know, there's different percentage ratio of the components that you're getting from the extract. And I don't know enough about the language of cannabis to feel safe. Like I won't travel to Colorado anytime soon. You know, I'm scared I'm going to buy a gummy bear and think it's just a gummy bear and it's going to be something else. I don't know what to look for myself in the right type or quality or quantity to be effective and, like you say, not be dangerous. So I think, again, for someone like myself, to your point, you know, getting assistance and monitoring that would be the most helpful.
Absolutely. You know, some of the states have done a few things on the recreational side that I think sort of speak to and hopefully address what you're concerned about. For example, in Colorado, if you were to go buy a bunch of gummies, first of all, you can't buy a gummy bear because they don't want kids thinking they're gummy bears, right? You can buy a gummy, but it's a cube or some sort of a shape, but it's not a friendly bear. And the second is that there's a unit dose requirement of no more than 5 milligrams of THC. 5 milligrams of THC is a fairly low dose. It's something that, you know, since you're not a cannabis user, you definitely notice, but it's not going to throw you into the deep end of the pool. And that's, I think, why they fairly wisely chose that number. It turns out that that's a number I actually like to use for my patients also. It's not necessarily their sort of final dose, but it is a good starting spot. So if I have Mrs. Jones come back to see me or come to see me from the beginning, and she has, you know, well, you know, I tried weed, Sonny, back in the 1960s, but I haven't since, kind of thing. Then essentially her body is naive to the substance, and 5 milligrams is a good place to start.
Okay. That's
maybe good. That she needs more ultimately for her back pain, and sort of, I would say 10 milligrams is kind of an average dose in my practice. 5 is where we might, start to get into the toe in the water.
Okay. Now, I'm not quite sure how to discuss this next question because I think it's a big question, but I'm probably making it bigger. The notion of healing and how cannabis plays a role in that. Meaning, is it a healing agent or is it more of a, I don't want to use the terms, it's going to sound insulting, but Band-Aid or mask? Does it mask pain or does it actually help heal the body? And so I know when we're in pain and we're in inflammation and when we're in states of stress that we have less ability to self-regulate and heal. So I'm assuming that the effects of cannabis would help that in general, but is there a healing agent to it?
I think that that's a complex question because the concept of healing is, sort of in the eye of the beholder. So when we talk about pain, for example, going back to Mrs. Jones, her back pain is generally from arthritis,
right?
And that's a mechanical process that is not going to get better. And so cannabis isn't going to make her back better in the sense of undo this wearing out process. So in that regard, for her pain, it's more of a treating agent than a curing agent or healing agent. She is going to continue to have bone on bone mechanical wear that is going to create pain, but cannabis is going to make her tolerate that better and have a better quality of life. When we get into sort of more of the philosophical and sort of psychiatric or psychological areas, then I think that there's more discussion or it's more open to that concept of healing. So if somebody has an anxiety disorder or they have PTSD, it's hard for me to say how much is just treating, meaning making them feel better on an ongoing basis versus healing. I guess the definition might be if you took this medicine for a while, then maybe you wouldn't need it anymore because you're fixed. And I don't know, are we ever fixed?
Right.
Or are we always on a journey?
It's a big question. Yeah, I know. Right. I know. But I think, what you're saying though, is if I had anxiety and even the relief of anxiety on a regular basis can perhaps retrain my central nervous system or my expectation or my relationship to anxiety in general, that I could learn or come to a place where I don't feel like I'm crippled or disabled by anxiety. And perhaps I wouldn't need the cannabis forever if I get to a new state of operating or feeling or awareness.
I think that that's certainly possible. I don't know to what degree the question is that the cannabis? Is that your personal growth? Does the cannabis facilitate that? Would it have happened anyhow? Did you do some therapy along the way that, what I can say is that for people who have crippling anxiety or PTSD, cannabis seems to help them with those symptoms and increase their quality of life.
Which
Whether
is awesome.
Call that curing or healing, that gets kind of metaphysical very quickly.
Yes, I know. And I'm a metaphysical kind of person, I suppose. But along the lines of PTSD or other emotional or mental illness or disabilities or challenges that many of us have, what is, and maybe you've already answered this, but what is the direct effect or salve from the cannabis use? Is it generally just a calmer state of being? What's helpful in a person that has either emotional or physical PTSD?
I think that one could try to answer that question on a biochemical level, and the ultimate answer there is we don't entirely understand how it works just yet, which is to say that we understand how it interacts with a bunch of receptors, but why that translates, into less anxiety is a little harder to answer. We do know that these cannabis receptors are present in parts of the brain, for example, the amygdala, which is a part of the midbrain that's involved in fear responses and aggressive responses, many of which we see in anxiety/PTSD. It's also involved in the hippocampus, which is a neighboring structure that's involved in both the encoding and recall of memory, which again we think is aberrant, particularly in the PTSD sufferer. But there's also an aspect where it interacts with the cerebral cortex, which is sort of the newer parts of our brain, the parts of the brain that we think of as being more human-like. And in particular, an area called the prefrontal cortex, which is where we think the I lives, the me, right? That's the part of the brain we believe is taking all the input from the visual cortex and the auditory and the frontal, which is where our judgment and also all of those voices that say naughty, naughty live. And all of that kind of funnels down through this prefrontal area that we think is synthesizing that into what we might call our ego or who we are. And if we can get in there using the cannabinoids from cannabis and kind of turn that down a little bit, some of our self-involvement, maybe our narcissism, some of those voices that are telling us that we're bad boys and girls, those things calm down. And that, I think, also contributes to being better able to cope with or have less anxiety and maybe, to your question, some healing.
It's really fascinating.
Oh, it's absolutely fascinating.
Yeah. And now, as we all know, the CBD industry and other parts of the cannabis plant are being studied and used for a variety of reasons. And again, big question, but how do you direct a person to gain benefits, what the whole plant or the broad spectrum plant or the CBD, or, where do you go? Is CBD as helpful and effective for anxiety, or do we need to go, search for a doctor who can help us with the medical marijuana that has the full effect with the THC and so forth?
I'm going to be really blunt here.
Please.
I think CBD is the emperor's new clothes. CBD has some very well-defined benefits for children with rare genetic seizure disorders. But all of this discussion about CBD for pain, for sleep, for anxiety, just not proven at all. Furthermore, the studies that have attempted to show this stuff have always shown that you need insane amounts of CBD to get any effect at all. Way more than what you can purchase down at Whole Foods or at your local, gas station. Worse, that at those higher doses, CBD can start to interact with conventional medications and cause dangerous reactions. And there's even some data that's not bad that shows that at those higher doses, CBD can be liver toxic in and of itself. So I think that the thing that makes CBD attractive is it's a great product to sell. People will project onto it whatever their concerns are, but generally speaking, it's not doing a whole hell of a lot unless you get into these high doses that nobody can afford to purchase. And even at that levels, there are some significant risks that need to be heeded. So I'm not anti-CBD. I just think that right now we've put the cart squarely before the horse, and we need to wait for science to catch up with CBD.
So do you think initially it was just a way to get a part of cannabis into the marketplace to start the movement of legalization of the whole plant, or just a money-making kind of opportunity?
Honestly, I think that, we had made a start on medical cannabis, and then CBD sort of swooped in from the sidelines and is largely derailing everything. And the reason for that is dear Mitch McConnell, who ran
from my home state. I bow my head in shame.
Yeah, well, there he is, right? But he looked at this and said, "Oh, well, you can get CBD from hemp, and in Kentucky, we'd love to grow hemp because it'll be good for our economy." And so he just pushed through in the 2018 Farm Bill that CBD was suddenly exempt from its former location in the Controlled Substances Act. And he's still pushing for it to sort of be freely available in food and drink and in supplements, with no regard to its safety profile, with no regard to its cost, no regard to people being properly informed about its presence in some of those things. So at the end of the day, it's about money. It's good to sell it. It's good to farm it, but it's not good to take it. And it's not good for patients necessarily.
Wow. What about the topical? All the topicals for pain relief and for this, that, and everything. Are they effective at all?
Nope. There's some data that there's some utility for cannabinoids for dermatologic issues. So if we have eczema or something like that, they have been shown to be effective, but not as effective as a good old, hydrocortisone. So you're still better off using hydrocortisone or something from your dermatologist if you have those sorts of things. There's some interesting data coming out about using cannabinoids for wound healing. So particularly in the elderly, they can develop these very large but very shallow breaks in the skin, either from pressure or from trauma, that are often very, very difficult to heal. And the cannabinoids seem to help that healing process accelerate, and that's very exciting. But when you get to the question, which is really, I think, what you were getting at, of, okay, Mrs. Jones has knee pain or back pain, can she smear a little cream on her back and feel better? The answer is she may feel better, because we know that those creams produce generally 30 to 40% response rate based on the placebo effect. But the question of, do the cannabinoids go through her skin into the joint space and then do something either for the inflammation or for the pain? The answer is no. We know those cannabinoids simply will not go through the skin. So on some level, you'd be better off buying, a moisturizer at CVS for $5 a gallon and rubbing that on your sore spot, rather than buying some cannabis thing where you pay $80 for a little pot of it like that. When patients ask me, I say, look, I don't think this is going to help you. If you want to spend your money, fine. It won't hurt you either. And most of my patients come back and they say, you know what, I tried it and it wasn't effective, and I'm just not doing it anymore.
Which is really unfortunate, full circle, because then those people think that cannabis use or parts of the plant, it just doesn't work for them, but they're not using the parts or in the way that could actually be beneficial, correct? I mean, it kind of shines a negative light on the whole industry.
I think that, so thankfully, if they've come to me, then I will have already said to them, look, if you try that, it's great, but I don't think it's going to work. Here's what I think we should be doing. And so that, I think, helps them avoid that negative light that you're talking about. But you're right, in the DIY case, where Mrs. Jones might go down to the local pot shop and the budtender might say, oh, try this cream. You're right. She may be like, well, this didn't work, so screw it. Hopefully, if it doesn't work, she says, well, maybe I need to go to talk to somebody about it. And she comes to me or somebody like me, and I say, well, I'm not really surprised the cream didn't work. They don't generally work for people, but here's what will work. And I think that, but the real essence of what you're getting at is that right now we have an entire industry that is growing up around the idea of giving sort of self-serving advice to people to make a sale, and that's not really okay.
Mm-hmm.
And
it seems very counterproductive to any therapeutic benefit at all.
Absolutely. So one of the things that the Association of Cannabinoid Specialists is doing is focusing on policy, and it is our contention that cannabis is a medicine and it should be regulated like a medicine, so that we would have the ability to not just recommend, oh, go get some, but rather required to write a prescription like we do for any other medicine. And there's a lot of value in that. First of all, it makes the clinician take ownership of the medicine and the patient care. And that sort of addresses some of that card mill stuff we were talking about. But on top of that, then if done properly, it transmits to the dispensing company what it is that should be sold, and if the regulation is properly put together. They sell that, but they don't sell anything else. So there's no arm twisting. There's no, try this. Oh, I see you came in for some cannabis flower. Don't you want a chocolate bar, right? I honestly have patients who have gone down to the dispensary to buy $45 worth of cannabis flower, and they come home with $400 worth of everything else. They try it all, and they come back to me and they say, Doc, nothing worked.
Right.
And I say, well, what did you do? And I hear all this story. I'm like, well, none of that is what I recommended to you. Did you try the thing I did? No. Okay, well, why don't you try that and tell me how it works? Oh, Doc, it worked really well. And I said, well, look, you could have spent $45 and not $400. But it's not their fault. It's that when they go into the dispensary, there's a dude behind the counter who's giving unsolicited or inappropriately solicited medical advice, who doesn't know what they're talking about. But worst of all, their job is to sell a ton of weed, right? So there's this conflict of interest there. So we need the regulation to not only require a prescription and the honoring of that prescription, but also get the budtenders out of the business of giving this advice, both on the medical and on the recreational side of things. So what I say to people often is, look, if you go into a pot shop and you say, dude, what do you have that goes well, with the fish I'm serving on Saturday night? Then, you kind of engaging in the conversation. It could have been a Cabernet Sauvignon, right? And that's fine. We'll get this one. It smells like this and it feels like that, whatever. I got no problem with that at all. But when the guy goes into the store and says, what do you have for my backache? That should trigger an immediate and immutable response, which is, I'm sorry, I can't answer those kinds of questions, but here's a page, here's a piece of paper with the names and numbers of a bunch of doctors who can help you.
Yes.
Be happy to see you again once you've seen them and know what you need.
Right.
That's the way it works right now. If you go, into the CVS, right, and you ask those sorts of questions, the cashier will send you to the pharmacist, and the pharmacist will send you back to your doctor. That's the way it needs to be.
Yeah. And you used a word that I've not heard before, and maybe it's a standard word in the industry, which is Budtender.
Oh, sorry. Yes, I took that for granted.
But I love it.
Well, so that's I think it's a California word. But essentially what we're talking about, in some of the dispensaries, they try to call them patient service advocates, but what we're really talking about is a cashier or a salesperson. Yeah. But budtender is the term that kind of gets used.
Well, I have to ask you, before you became a doctor and focused your life on this industry, were you a marijuana user?
I tend not to talk about my personal health care.
Okay.
So
I guess I meant more recreational, but okay. So if you don't want to talk about that, what about people who have used it recreationally for years that don't have this information, much like myself, even though I'm of the age where I should, but that don't have the medical information, but are still using it recreationally? I know that that's, to each their own and so forth, but a lot of those people ended up in jail, or they ended up with some kind of negative thing that happened in their life. Yeah, some kind of record of some sort. What is your stance or viewpoint just personally on those people and educating them and also helping reform the old mindset that goes with you're a bad person?
Yeah. Well, unfortunately, those of us who are of a certain age, I think we're never going to get past that little voice in our head from Nancy Reagan, just say no, right. Or the egg in the frying pan. I think that those things have scarred us for life. The younger folk perhaps been able to escape that. And you're right, there are a lot of folks out there. First of all, let me back up and say, I don't think anyone should go to jail or get any of these negative consequences that we've existed with for so long under this war on drugs. The war on drugs was a stupid idea. It had all sorts of political and racial motivation. Thank you to Richard Nixon, and it needs to go away. And that's the conversation that seems to be happening in Washington at the moment, and that's a good thing. I'm all for it. But I also think that what's unfortunate and frightening is that while there's all this discussion about ending the war on drugs, there's absolutely no discussion about how to take care of patients.
Mm-hmm.
And so I support the social justice aspect of reforming our cannabis laws, but I also think it's overlooked at the moment, that we're talking, medical applies to a much larger group of folk, roughly about 180 million Americans, and that healthcare is clearly a social justice issue as well.
Mm-hmm.
And I think that we need to be wise enough to address all of the above. It's not an either or proposition. So I think, that's, again, a lot of what I spend my time doing through the Association of Cannabinoid Specialists, is really focusing on DC and trying to remind folks down there that while we are talking about legalization, we need to provide for patients.
Right. It's absolutely true and necessary. And I want to ask, on the heels of that, do you believe that the psychedelic movement that is happening is aiding the cannabis industry, and information and use for medical purposes and psychiatric purposes, or will be another thing that swoops in and kind of diminishes its effect?
That's fascinating. So historically, that swooping in is exactly how we ended up in the shit position we're in right now.
Mm-hmm.
Most of your listeners, I imagine, are probably not aware of the fact that psychedelics, particularly LSD, was used medically throughout the late 40s and all the way through the early 60s under tightly controlled medical conditions, and was very successful in treating people's anxiety, alcoholism, and a range of other conditions. But they were always done sort of in that medical setting where there was close monitoring and very specific protocols for how the treatment was given. It wasn't just like, dude, take some LSD and call me in the morning. It was, in a comfortable room with appropriate setting and ambiance, and with trained, guided folk and psychiatrists, and that was very effective. And then, of course, the 1960s, which is really the late 1960s, happened, and these substances made their way out of the lab and onto the street, and then became part of the hippie counterculture. And so we got to the early 70s, and Nixon said, let's just screw them all by putting it, making it all illegal. and so in many ways, as much as the hippie movement of the 60s and early 70s was a lovely thing, and I'm not trying to poop on any of that, but it did really set back the medical science and treatment using psychedelics tremendously.
Mm.
And once it became illegal, nobody in any of these medical settings was able or willing to touch it until very recently. I think that, if the research that's coming out now continues in the direction that I think it's going, which is to say back towards that more medical, careful, thoughtful approach, then I think this will move things forward. If it ultimately somehow just gets derailed again into, well, look, dude, MDMA has been shown to be therapeutic, so we should all be just kind of dropping MDMA, then I think we're going to end up in another one of those negative cycles. I'm just crossing my fingers that doesn't happen.
Yes.
I think MDMA will be prescribable fairly soon,
Mm-hmm.
and that will be a good thing, again, if it's done in the right setting. If, on the other hand, we get, card mills popping up to prescribe MDMA to people who want to go out and rave, then we're going to have a problem.
Right. It's so fascinating. I appreciate your input and information about this so much. And before we go, I have two final questions. Your practice, InhaleMD, correct?
Yep.
Is focused on, tell us how your practice is different than a general, or what someone might consider another medical practice. Are you focused primarily on the use of cannabis in all of your treatments?
Yes, this is what we do. We offer a few other sort of ancillary things like psychotherapy, but the focus really is on cannabis and cannabinoid medicine. It's really all that I do at this point. And one of the very basic ideas that I think you've heard me say over and over again is cannabis is a medicine and needs to be treated as a medicine. So we spend a lot of time with our patients. Our first visit's an hour. When was the last time anyone spent an hour with their doctor? And we, provide a very deep understanding of the medicine for our patients. We make sure that they go home with all of this stuff printed so that so it's not just sort of in one ear and out the other. Everybody has my contact information so that they can ask questions or ask me, is this the right thing to purchase? And then we follow up with everybody on a very regular basis over and over and over again to make sure that they're getting the benefit that they need, that they're not developing problems, that they haven't been derailed by the cannabis industry in any of this process. And so I think that, to me, your question was sort of, how are we different? I would say we are similar to any other traditional or conventional practice of medicine, but somehow that idea is novel in this cannabis world where, generally speaking, it's kind of like, yeah, dude, whatever. And I don't think this is a good, yeah, dude, whatever kind of medicine.
I see. That's really interesting. Is there any person, I've heard just through the grapevine and casual conversation, that some people maybe with bipolar or other psychiatric issues may not benefit or use caution around cannabis. Is this true?
Oh yeah, I mean psychotic disorders like schizophrenia, we definitely see that there are some issues there. It can be dangerous for folks with bipolar if their mania isn't well controlled. I have a bunch of bipolar patients who I treat, but these are people who have been stable on their medications and without, serious complications of their bipolar for years, and who have some other issue going on, like again the back pain or whatever. But it's not even limited to psychiatric illness. People with significant heart disease may be at higher risk from using cannabis. So it's not that they can't use cannabis, but it's that there needs to be a discussion, a thoughtful discussion between the doc and that patient about what are those risks, how big a risk are they, and how do they stack up against whatever it is that we're trying to make better with the cannabis, right? I saw a guy last week who has very severe coronary disease and a very weak heart. And cannabis makes all of that a very high risk for him. On the other hand, he has, tremendously debilitating symptoms from something completely unrelated. And right at this point, he is willing to acknowledge the risk to his heart, and the other issues are more important to him in terms of quality of life. And so, he understands the risk, and then we're also going to follow him really closely. And since I saw him last week, I've had 3 or 4 emails with him already just to help guide him through the process of getting started. And that's the thing. It's really not a yes or no. It's really what is most important. Do you understand what those complications might be? And how do we work together to sort of downplay or mitigate those risks so that the balance becomes more towards benefit?
That's great. And it is, highly important, I think, for any medical care, that we are individualized. As you say, we're all, organisms and human beings that function similarly, but you have to pay attention to what's going on. I think my final question is to answer that old idea, like the pot is a gateway drug. Is it addictive? Is it that kind of starter drug? Even if you're using it medically, could it lead to more, kind of like tobacco does?
So there are a few questions bundled in there.
Yeah, sorry.
No, it's the question that people need to hear the answers to. It's just not a simple answer. And so let me try and break it down a little bit. The first is that we tend to use the word addictive in a little bit loose terms. So it's really important for us to separate out dependence from addiction. And dependence is that need for more and more and more, right? That we were just talking about. And And that's really a physiologic thing, right? You take this substance, your body gets used to the substance, and then you either start using more of that substance and you become more dependent on it, or you cut back, and then you get withdrawal symptoms, right? Your body essentially lets you know that it's not happy with you for stopping, right? That does happen. It doesn't happen very often in adults, right? It happens more in the teen and young adult. But if you make it, I always say, to the ripe old age of 25, then your risk of that drops to about 2 to 3%, which isn't very much, but it's not zero.
Right.
The other thing that's important for us to address is, what does cannabis withdrawal look like? We all have this sort of Hollywood idea of somebody sort of sitting half naked in the corner of some dingy house somewhere, puking, screaming, sweating. That's not cannabis. That's opioid withdrawal. And even that's a pretty sensational view of it. But cannabis withdrawal tends to be about a week of being kind of cranky and having trouble sleeping. So it's not the end of the world kind of thing, and it certainly can't kill you or anything like that. But we can see that escalation of tolerance, and ultimately that kind of dependence form. And in its worst condition, that can lead to cannabis use disorder, which can be somewhat difficult to get away from. But this gets me back to the issue around dosing. Mm-hmm. When we use cannabis wisely, with the appropriate amount and the appropriate timing, we don't see that tolerance escalation happen. And so for many of my patients, they're on this low dose, 5, 10, 15 milligrams once or twice a day, and that's stable. And that's the way we want it. But if they're incautious, or they're encouraged to be incautious, and they start taking just a little more, just a little more, just a little more, then that snowball starts to roll downhill, and that's what we want to avoid. The cannabis use disorder is where we really get into that addiction concept of maladaptive behaviors, right? And we don't see people generally robbing liquor stores to get money to buy cannabis. So that level of sort of addictive behaviors are not very common. But we do see people sort of start to plan their life around cannabis, and it can become intrusive and harmful to sort of their participation in normal daily activities. And that's exactly what we want to avoid. And avoiding it is done by being precise and meticulous about how we use it for treatment. And none of that concept exists on the recreational side. And so there's where we can get into trouble.
Mm-hmm. Right. Thank you. That was a very good explanation.
Thank you.
Well, Dr. Tishler, I appreciate your time so much. I thank you for your work. And for those who want to know more, go to InhaleMD.com. Perfect. And you have a lot of other videos as well with more information available.
Videos, articles, and I think the most important thing for people is you can email me through the website. And so if you want, to have a consultation, absolutely, we do. We practice completely by telemedicine at this point, and we take care of people around the world. So if any of your listeners are suffering, please, please, please get in touch. We'd love to help you.
Thank you so much. And we'll be in touch soon, and a good day to all. Thank you, Dr. Tishler.
Thank you.